To discuss today's ruling. Congressman, thanks for joining us today.
Thank you for having me.
So the Supreme Court ruled that the Trump administration did not provide adequate reasoning to end the policy. Immigration is obviously a huge factor in Arizona. There are about 25,000 DACA recipients in your state. So do you think the Supreme Court was right to rule in favor of so-called dreamers today?
Yeah, no, I don't think they were right. I think the way that the opinion was structured, and this is really important, is they said that the Trump administration can end DACA, but they didn't follow the proper rulemaking process to rescind the DACA establishment. But what's ironic is DACA was born without following a rulemaking establishment. It was based on a letter by the Department of Homeland Security Secretary. So that's why the minority was writing against it. So here's the important point. The important takeaway is all 9 members of the Supreme Court said the DHS Secretary and the Trump administration can end DACA. They just have to follow the correct rulemaking process.
And DACA has been a very contentious issue in Congress. It's been used as a bargaining chip in some immigration negotiations. So now that the Supreme Court has ruled, do you think Congress should take this up?
Yeah, well, actually, Congress will probably not get it done if they take it up. They've tried it back and forth. You're correct when you say it's been used as a bargaining chip and a political lever. I would imagine, and I think that the Trump administration needs to look at it very carefully and say, what could we do if we really want to end DACA? How would we do so in keeping with the court's ruling? And the court's ruling allows them room to do that.
And Congressman, I do want to discuss police reform as well. Senate Republicans introduced their version of a bill yesterday. It provides more money to police departments so they can train officers to de-escalate situations. It also incentivizes the departments to ban chokeholds but doesn't ban them outright. It also tracks no-knock warrants but doesn't ban them as well. So what are your thoughts on this bill, and do you support it?
Well, it was released while I was in the middle of a hearing in Judiciary, so I haven't fully read it, but I've been vetting it with my staff a little bit. We've been discussing with some colleagues. I don't know that I get there to support it yet because I just haven't had the opportunity to fully vet it. But I will say this. The Democrats just totally said no way, we're not going to view that because they want the House version. So we'll have to see what happens between the 2 versions and if a 3rd version is hatched as we go along.
And I do want to also discuss coronavirus. Cases are spiking in your state of Arizona. Local health officials say state hospitals are weeks away from being overwhelmed. Should the governor be tightening restrictions again to keep the virus from spreading?
No, absolutely not. And here's the thing to understand. We've had more testing. We still have 20% of beds not in use. We still have 2/3 of our ventilators not in use. And what we are seeing is the reason the hospitals are full is because we went back and started allowing elective surgery again. So the hospitals aren't full. There's room for them. There's some really important data and metrics that we need to be looking at, like what is the % positive test ratio that we get? And that's gone up a little bit. How would we match with other states around us? And we're pretty close to where other states are. As the case fatality rate maintained itself, yeah, it's about the same rate, and we're getting more testing done. I think it would be a mistake. There's so many other social pathologies that can happen, public health issues going on the other side of that. So if you go back to a lockdown state, don't forget we had, for instance, we had people not getting their testing done to see if they had cancer. We had half of chemotherapy patients missing it. We had some estimates of as high as 80% of brain surgery patients not getting the surgery they needed, and we had higher suicide, domestic violence, child abuse, and additional alcohol and drug abuse issues going on. This is a tough issue. I get it. No one's saying it's not serious, but there are ramifications if you go back to locking down too.
Congressman Andy Biggs of Arizona joining us live from Capitol Hill. Congressman, thanks for speaking with us today.
Thank you so much.